Hello guys, I Dr. Suryadeep Singh will be discussing an unusual tooth condition called paramolar today with you. Let's start our video. Today a patient came to our clinic of age about 40 years having a complaint of mobile tooth in the socket, severe pain and sensitivity along with the swollen gums. On the examination of the patient we found it not a normal tooth in the structure and position as it should be like the molar region tooth. So, on the further examination, we found it to be a tooth condition called paramolar. Now, you all would be wondering what is a paramolar tooth. The paramolar is a supernumerary molar, usually small and rudimentary, most commonly situated buccally or palatally to one of the maxillary molars. Paramolar is a developmental anomaly and has been argued to arise from a combination of genetic and environmental factors. Now you know it is an extra tooth or a supernumerary tooth, but how common this condition can be? Well, according to the NCBI data, it can be. Reported prevalence of the supernumerary teeth in the permanent dentition ranges from 0.1 to 3.8% and from 0.3 to 0.6% for the deciduous teeth. In the permanent dentition, the supernumerary teeth are more prevalent in males as compared to the females with a ratio of 2:1. So now you know what is a paramolar and how rare this condition is. So now back to our case. Here we found a paramolar on the right hand side but in between the first and the second molar in arch. So we decided to save it as it is forming a proper occlusion with the arch with the other teeth. But on the further examination, we also found the paramolar tooth on the left hand side, which is buccally placed. After the clinical examination, we done the X-ray of the symptomatic tooth. We found that the distal side of the symptomatic tooth is carious, through which the infection found its way to the apex of the root, leading to the periapical infection. Then to save the tooth, we done the RCT procedure on that day. On the next visit, the patient showed no sign of any problem as he was suffering earlier. Mobility of the tooth was absent, pain and sensitivity subsided. So, we now completed the RCT procedure by placing the GP cone and finalized the permanent filling. This is the finalized tooth after the complete RCT procedure. Here you can look at it. As this was a paramolar condition, but the condition like its proper position and occlusion, we decided to save it. But if same problem were found with the left hand side paramolar of this patient, we must have gone with the extraction procedure by keeping the normal teeth long term benefit in mind. So this was an unusual tooth condition called paramolar and we save it through the RCT. Thank you. Please like and subscribe the channel. See you soon with the next video. Till then, bye bye.